So years ago, about the same time actually that this article came out, and even way before that, I was very frustrated as a practicing family practitioner, because every day, and not just once a day, but multiple times during the day, I'd have patients, just as this slide refers to, where I couldn't figure out where their symptoms were coming from, but I knew that they were real. So I was very frustrated. At one point, I even considered leaving medicine because I felt like I wasn't enjoying it, and I really wasn't helping my patients, at least not the way that I wanted to, which was to really try and get to the root of the problem. What is causing their symptoms, and what can I do about them or help them find answers? And this article actually went on and talked about that it would be using the term functional or using functional illness would be a good way to approach this. And so that's why, to me, functional medicine has really been the answer. Because we all know that there's a great unmet need. And Dr. Holman has written various articles about it. He was actually interviewed by Jeff Bland earlier this year in the Functional Medicine Updates talking about this problem. And he's not the only one. We've had other well-known doctors throughout the United States talking about this. And they've all talked about that the problem is that we really don't have a model to address chronic disease. And although they have made several good attempts, or really several really good recommendations, at least in my mind, they really didn't give me a model or something that I could take into my office and practice and use day after day that worked, that I found was efficient. But they've all sort of discussed the same things, which is that we need physicians who look at our patients or our problems from a functional medicine, or rather a systems biology perspective, and that we have nutritionists and pharmacists and other allied health professionals that help us do that. But I still felt like they didn't give me a model, and it wasn't until I found functional medicine that I found that model. So really, what is functional medicine? Well, it's really a way to address and treat chronic disease, and hopefully to actually prevent it before it happens, because we're going to be looking at function instead of a disease model. And it's not really an alternative. To me, it really comes out of conventional medicine. It's just a better way to approach chronic problems. And what we're talking about is really a mind-body-spirit equilibrium, and using the systems biology perspective to do that. Because after all, that is how all living systems are, right? They're all integrated. So what I'm going to do today is, first I'm going to go through the functional medicine tree and go through the principles of functional medicine, review the core clinical imbalances, and show you what the model that we use is, which is a matrix, and then apply that matrix. So we'll be going through the different areas of the matrix in detail with some case presentations. So what is so special about functional medicine, right? Well, really what functional medicine focuses or sees as its main area is the genetic predisposition, which we all have, right, and integrates it into this physiologic processes that we also all have, and filters them through these fundamental clinical imbalances that we're talking about to address patients' needs. Now, it's not that we don't use our cardiology and endocrinology colleagues. It's that they are not so much the focus. They become the branches of the tree, but really it's the root and the trunk that we're focusing on. So let's go through the principles. Well, the first principle is really biochemical individuality. So that means that we each are very individual, based on our genetics, but also in our environment. And functional medicine is really about being patient-centered. So you focus on the patient and not necessarily the disease, finding the disease or naming a disease. It's also a dynamic balance between internal and external forces. And it's also taking into account all these web-like interactions, that everything is in a sense related to everything else. And really looking at health as a positive vitality, and not just does this person have or not this disease. Now, for the purposes of being brief and integrating things, I've included or rather grouped the last two principles into just a continuum of health and wellness, and then we'll be going through each of these. So what are we talking about when we talk about a continuum of health and wellness? Well, it's not whether you have it or not, right? Most things in life are in this continuum. It's not whether you, for example, have or not diabetes. We now know, especially with respect to diabetes type 2. And we're finding more and more with type 1 too. But so it's really about this progression, right? Or this, what I call this continuum. And we're all in this health continuum, where if you have wellness on one side and illness on the other, what happens to all this in between? Because, as we all know, you can have dysfunctions and not necessarily have any symptoms, right? But not be totally well. And that's what we're really trying to find. Actually, at least my goal is to really try and find patients when either they have early symptoms or not very many symptoms, because it becomes much easier to do our job or to prevent an illness. Balance. Well, we're really just talking about a balance between all forces. Among internal, external, mind, body, and spirit. Biochemical individuality. Well, it was first coined by Roger Williams in 1956, and that was really to explain the genetic variability that he was seeing in susceptibility to disease. Also in regards to nutrient needs and drug responsiveness among people that were pretty healthy. And Bruce Ames has done a lot of work on this area as well. Because really what we found, and in part a lot of this due to Dr. Ames's work, is that in many of these cases when you have, for example, polymorphic mutations, it's not that we're trying to overcome our genetics, because we can't really change our genetics, but it's really what those genetics are coding for. Many of them are coding for something that you just need a higher amount of, such as a nutrient or cofactor, so that in a sense we can overcome those. Walter Willett has also done much work on this area, and he's really talked about how diet and lifestyle, it's basically what you do with your genes, what environment do you bathe them in. So if we're looking at health and disease from a functional model, we're really talking about that gene-environment interaction, as I mentioned, which can then produce a functional imbalance or a dysfunction that can then lead to a disease and even death at times. And so what we're trying to do is to identify things when you have a functional imbalance, mostly by patient symptoms, as well as some laboratory values that we'll go through, or laboratory testing, so that then you can restore someone to health. So that gene-environment interaction becomes really important. It is what makes us us, or very different from other people, because you can have someone with very similar environments, right, that will develop different diseases and vice versa. And this is nothing new in a sense. I mean, this is from 2000, where CDC said that virtually all human diseases result from an interaction of your genes and some environmental risk factors, which many of them can actually be modified. And you see this in basically all diseases that we come across. Patient-centered. So what are we talking about there? Well, we're really talking about focusing on the patient, centering on the patient and their story, and not necessarily in naming that disease. Now, we all live in times of ICD-9 and ICD-10 codes, but if you can be less preoccupied with trying to name a disease and more understanding what is going on with the patient, which isn't easy in the beginning, then you start to really understand what is going on. What's going on in that physiology, and how can you address it? How can you help that patient? So in a sense, a functional approach is really patient-centered, it's holistic, and the therapeutic regimen is really to try and identify the signs or symptoms of imbalance and bring it back to balance. And like conventional medicine, where it's a more of a pathophysiologic approach where you're trying to name the disease, and I'm not sort of downplaying the importance of that. You know, if I'm about to have an MI, I want that. That's exactly what I need. However, the problem is when you try and take that model and use it to address chronic problems. So interconnection. What am I talking about there? I said earlier that everything is related to everything else, right? That's really what we're talking about. So when we name the fundamental functional imbalances, which is gut or digestion absorption, immune surveillance, inflammation or inflammatory process, oxidative stress, detoxification and biotransformation, hormone and neurotransmitter regulation, structural imbalance, mind and spirit. And really, these are all connected to each other. There's all these interconnections. That's really what we're talking about. Because this is really what becomes our matrix that we use. And so every area on that matrix is related to another, so that it doesn't really necessarily become really important where you start. And with some degree it is, but really because everything is related, it doesn't really matter, because eventually you will get to your answer. You'll get to where you need to be.